get your notepads and pens out and write questions down. We're going to have a moderators panel at the end of the session after the break, and we're going to ask questions there. So everybody write your questions down, hold them. One concept that unifies Jeff and our second speaker, Gena Cook, is they're trying to bring all this data and information directly to the patients. And I don't know if you're appreciative or not, but we're in the midst of this really big healthcare change, not just around insurance, and that's kind of dominating the news right now, but just these bigger demographic changes combined with all this information. We've got to find some way forward that's probably not going to be the same old model of patient going to the doctor's office and kind of getting a little health care and going home. We're going to have some model where as we get more and more people using health care, as demographics, people get older, larger insurance and such, we're going to have to find some cutting edge way to bring healthcare information to patients and sort of help them come to grips with all this new big data that they're getting. So our next speaker, Gena Cook, is the founder and CEO of Navigating Cancer, which is one of those Mountain View high-tech, or I guess Washington State high-tech companies that are trying to handle this issue of how do we bring a whole bunch of rapidly changing information to just the average patient. And in her case, obviously, it's cancer patients. She founded Navigating Cancer a couple of years ago. Before that, she was a VP at McKesson with a $3.5 billion responsibility for the oncology franchise. And she was at Bristol Myers Squibb working in the pharmaceutical industry before that in various roles. So without further ado, come on up, Gina, and tell us about Navigating Cancer. So.
Thanks, Mark. So like Jeff, I came from the West Coast, so at 6 a.m. in the morning, I'm hoping my brain and my will turn on this morning as we get started. Okay. This is one, right? Great. Well, thank you very much for having me here. I really appreciate it. Before we get started, I think it's important just to talk about technology, and if we talk about technology and how that's going to relate to personalized medicine, I think it's just important for me to take a step back and just think about how technology is impacting our lives. So first of all, I'm dating myself, but 25 years ago, when I graduated from college and I started my first job, I didn't use a computer. And in fact, the internet hadn't yet been commercialized. So the technology that I used in my first job was a telephone, and actually it was a payphone, remember those? I used a fax machine, so I was pretty high tech at the time. I used a clipboard and good old-fashioned paper and pen. So I was in pharmaceutical sales, and so I used a clipboard to record my calls that I made on doctors. And then at the end of the week, I faxed a summary of what I did to my manager. And when I wanted to talk to somebody within my company, I left them a voicemail on a payphone. And they left me a voicemail. I rarely talked to anybody real time. And what's interesting about that, oh, and before I get started, so I have a financial interest in Navigating Cancer, so there's my disclosure statement. But what's interesting about that is, how fast technology has changed. So today, as Mark mentioned, many of us carry around a supercomputer in our pocket, right? So this device, our cell phone or our smartphone, actually has more computing power, as Sheryl Sandberg said, than the first Cray supercomputer. So that first supercomputer weighed 5.5 tons, cost $26 million in today's dollars, and today for a couple $100, we have more computing power. We're going to talk about space today, but this device also has more computing power than the computer for the space shuttle. So right here in our pockets, and it's changing how we live our lives. So just yesterday when I traveled here, I used this device to call up a car service, Uber, and they knew my location, and I could see with full transparency where that car service was, so I could be ready when they arrived. I used this device to pull down my boarding pass and went through security with it, and then on the way to the gate, I bought a cup of coffee. So these are we have more information and transparency of information at our fingertips than ever before. But what's interesting is when we interact with our doctor's office, when we walk into our doctor's office, the technology that we are using in 2014, in this year, as a patient, is the same technology that I used 25 years ago in my first job. So it's almost like when we walk into a doctor's office, we just time travel right back to 1991. What happens is that, when we get there, we're handed a clipboard, a pen and paper, and asked to fill out our medical history, and we fill that out over and over again, even though we hate it. And we use, when we need to make an appointment, what do? We pick up our cell phone, and we call, and we leave a message, and they leave us a message back. And yet, in our everyday lives, we use email and text and technology of more information at our fingertips, but we're not really translating that as we walk into the healthcare system. And what's interesting as we think about personalized medicine and what's happening in the advent of cancer care, we have to do better, right? So in a time where we know more about the genomics of, our bodies and the biology of cancers, we need the technology to catch up so that we can really take care of patients in this new era. So no longer are we going to be treating cancer patients with the same drugs and the same, lung cancer patients all the same. We're going to look at their specific biology of their tumor and create treatments that are very personalized. And so we have to think about how we take the lessons learned from the technology that we're using in our everyday life and translate those successes into the healthcare environment. So luckily, there are a lot of reform objectives that will dictate changes around healthcare reform and patient-centered care. So it all started, lots of talk about the ACA and what's happening with insurance, but this healthcare reform really started in 2009 when Obama signed into law the American Recovery and Reinvestment Act. A big part of that was $22 billion earmarked for what's called high tech, and that was all around digitizing medicine. So providing incentives to doctors to digitize their practices and to adopt and meaningfully use EMRs. One of the top 5 goals of high tech is engaging patients and their families to improve care coordination. And so this year in 2014, doctors, if they're going after the stimulus money and going after stage 2 meaningful use, will need to adopt patient portals to actually give patients electronic access to their health information, online secure messaging so we can email our doctors, personalized patient education, and more using technology. So high tech's just the start of that. Alternate payment models are also building on that. So accountable care organizations, medical home models, new alternate payment models are also requiring many of the same things of high tech, but in larger quantities. And then there's also these cost and quality initiatives. So the new Commission on Cancer requirements that in 2015 are going to require both navigation and survivorship services. We're going to need technology to support that. COA's Medical and Home Initiative, which is all around patient satisfaction and starting to understand what patients really want. And then there's also this consumerism in healthcare. So 23andMe is a great example, but as costs start to shift to us as consumers and we're paying more for healthcare, we're going to care a lot more. And so there's lots of companies that are building transparency tools so for us as consumers to really understand healthcare and so we can take a more active role. So because of high tech, we're seeing EMR adoption soaring. So this just gives you a sense of, in 2009, 48% of physicians had an EMR. 2012, it was 72%, and I can imagine that the 13 data is even higher than that. In oncology, in 2012, 82% of physicians had an EMR. I just saw data last week based on 2013 where only 8% of physicians don't have an EMR at this point. So 92% of oncology physicians are using an EMR because of high tech and the healthcare reform initiatives. What's also happening is patient portal adoption is increasing. So as of last year, nearly 50% of hospitals currently have a patient portal, and 40% of practices have patient portal technology. And so again, this is increasing because this year, if practices are going after the meaningful use objectives, this year is the deadline. So we'll start to see that increase over time, and as consumers and when we go to our doctor, we'll start to get access to our health information through these portals. What's interesting about that is that there was reports last year from CLAS that most providers are choosing modules from their EMR as their patient portal technology. But what's interesting is EHRs really aren't designed for patients, and so there's also reports that patient portals don't really help with patient engagement. So they're, and this also just gives you a sense of the increasing requirements. So it started with stage 1 in 2012. Providers needed to provide patients with timely access to their health information. They didn't have to do it electronically. They could do it with a piece of paper. But in 2014, providers must give the ability for patients to actually access that electronically and to be able to download that information as well. And then in 2016, with stage 3, those requirements continue to increase. One of the often one of the misconceptions that I hear is that patients are too old, especially cancer patients, to access their health information. And what we're finding at Navigating Cancer is that's not the case. So baby boomers are actually the fastest growing demographic on Facebook. And according to Pew Internet Research, 59% of seniors report that they go online. 77% of seniors have a cell phone, and greater than 90% of seniors go online if they have income greater than $75,000, and it's 87% if they have a college education. So our data at Navigating Cancer shows pretty similar results. So what we find is that 50% of patients that are invited actually sign up and use their patient portal. When we ask the other 50%, why haven't you joined? 30% didn't know there was a portal available for them. So indicating that there is a high degree of interest, but patients just don't know about it. We ask them, did your healthcare professional tell you about the portal? 75% say no, that their healthcare provider didn't. So it just provides an opportunity that there's increased learning, increased learning for patients, and an opportunity to really tell your patients about this service that you're providing to them. So as we think about technology in the era of personalized medicine and what really needs to change, and as we think about how technology can support that, I thought it would just be important to take a step back and really talk about what technology's role is in this. And for me, I believe technology is the enabler, and it's the ability to support the care model, but nothing really replaces the human interaction and that relationship that develops between a patient and a provider. But technology is changing that relationship, whether we know it or not. We're moving really from 20 years ago, where the healthcare provider had all the information and they shared information with patients on a need-to-know basis, to where we are with the internet, where patients have access to all of that information. And so from a physician perspective, we're moving from a decision maker, and I don't know if this is the best word, but more to a coach. And more of a, and as we know, all great coaches and really successful coaches, they know their players, they know their motivations, their behaviors, what really motivates them so that they can get the best outcome. And I think that providers have this opportunity, as patients get more access to information, to establish a different relationship with them, to motivate them to really change their behaviors in this value-based world. So I want to talk to you a little bit about what's that technology. So we think about technology in the era of personalized medicine. What's that technology that's needed from a physician perspective, and then also what's needed from a patient perspective. So on the physician side, EMR systems and practice management systems are imperative, but probably insufficient as we think about personalized medicine. So doctors have electronic medical record systems, they have practice management systems, and now they have patient portals to really manage their practice. But what it really is going to be required is personalized information on every patient. And so a lot of times EMRs are data, you put a lot of data in there, but you're not getting information back. So decision support, deep analytics information, population health, you're going to need layer-on tools that give you that deep information that's really personalized to each patient. And as you implement patient portals become an opportunity not only to deliver information to patients and give patients access to their health information, but also to pull information back. So you can start to pull, what patients are doing to really understand patient activation scores. So you can understand what patients are doing and what needs to change and so on and so forth. You can cull out patient-reported outcomes, so you can start to understand what patients' experiences are, so you can take care of them better and provide better interventions. From a patient perspective, patient needs, and I think what's great about patient portals and leveraging these portals is it's an opportunity for you to provide technology to your patients within the care model. So overwhelmingly, the research shows that patients want this information, but they want it from their healthcare professional. So you can help them, make them smarter by giving them access to their health information, personalized education, connections with other patients, and smart prompts, along the way so that they can really take care of themselves. Patients want access and they want things to be easier. So we can actually use technology, email, text, these things that they use in the technology that they use in their everyday lives, we can translate that to healthcare. And also patients want support. So cancer is a pretty overwhelming, lonely, emotional disease. In a personalized world, making connections with other like patients so that they can connect and learn from other patients is a really powerful thing as well. And that is something that technology can provide in a personalized world. So we're connecting in a HIPAA-compliant way thousands and thousands of patients every day. Many times healthcare professionals are really worried about patients connecting with each other. They're worried about patients providing incorrect information to each other, and we're finding completely the opposite. So patients are providing really a lot of emotional support to each other. They're giving advice very similar to what you would want them to say to each other, which is, eat right, take a walk, call me if you have an issue. They're really providing more psychosocial support than anything. So overwhelmingly, the data suggests that patients want access to their health information. So over the last 5 years, there have been numerous studies by Commonwealth, RAND, Microsoft, Deloitte, even Navigating Cancer that shows that patients want access to their health information. They want personalized tools from their doctor. They want secure messaging. And again, what we're finding at Navigating Cancer is that patients really do want this information. 50% of patients invited do join the portal. Often, many of them don't even know that the portal exists for those patients that aren't. They haven't yet been invited. They don't have an email address yet, and so they're not being invited. And then what we're also finding is that 68% of the visits or the users are visiting 4+ times. So they're coming often and really utilizing the service. So every time they have a new labs, clinical summaries, connections with other like patients, they're using the tool to communicate with their family and friends. So they really are using this and coming often to use the service. The other thing that a portal provides is the opportunity to provide personalized patient education. So oftentimes what happens when a cancer patient gets diagnosed is they have a 1-hour chemo teaching right before they're ready to start chemotherapy. It's a pretty overwhelming time. They're still trying to understand that they have cancer. They're really worried about chemotherapy and what the effects are going to be. They just had a port inserted. It's a pretty overwhelming time. And so they walk away from that hour pretty overwhelmed with a packet of information where they weren't able to comprehend a lot of that information. A portal provides the opportunity to really communicate and educate patients in a really personalized way. So at our company, we created a patient education program where we allow healthcare providers to digitize their education and create a rules engine around that so that they can start to dictate what patients should receive by diagnosis, by medications they're taking, and also across the time continuum. So you can start to dictate that 30 days after a patient starts a particular chemotherapy regimen, you want to communicate this information. So really bite-sized, digestible chunks of information in a personalized way, appended to their health record that a patient can access at any time. A portal and technology also provides the opportunity to improve medication adherence. So what you can do is send real-time reminders to patients. So in cancer, 30% of chemotherapy is now oral, and that is increasing. And so technology gives you the opportunity to give them real-time reminders to patients. Did they take the medication? If they did, why or why not? And then that data can be pushed back to the healthcare team so that they can provide real-time interventions and start to understand what's really happening with their patients. Technology also provides the opportunity to avoid costly hospitalizations with toxicity and symptom reporting. So technology also provides the opportunity for patients to report patient-reported outcomes, their symptoms and side effects, what they're experiencing real time, and providers to provide real-time intervention. So not having this information from patients sometimes is a bad thing. Patients oftentimes don't want to call their doctor, they don't want to bother their doctor, and yet they're feeling a lot of symptoms and side effects from the therapies they're on. A little example of that is a patient that is dehydrated, and is feeling poor, but doesn't call their office. And so at 6 p.m., they end up in the hospital. And at 4 p.m., they could have been in the doctor's office for a $200 bag of saline, but yet now they're in the hospital for an overnight stay just because they're dehydrated. And so you can really think about technology as a way to provide, for patients to provide information back for a nurse or a triage manager or for somebody to really look at that data and be able to provide the right interventions at the right time. So sensors also in technology are an opportunity for us to really understand what our patients are doing. And from a cancer care perspective, is I've been wearing a couple of these sensors around, just trying to figure out what's the applicability as it relates to cancer patients. There was just research published this week with Pew Research that indicated that these sensors will be mainstream in the next 10 years and that we will be able to provide actionable data on those. So one of the examples of where this might be applicable in cancer care is that we can record real-time activity level on patients that relates to performance status. So when a doctor is seeing a patient and they're looking at their tumor scans, they'll also be able to look at their activity level and that performance status and how that might have changed over time. So that creates an opportunity as well. And lastly, as it relates to clinical trials. So 3% of patients go on clinical trials. As we think about personalized medicine, if you look at the FDA and the new drugs that are being approved over the last couple of years, everything is a breakthrough therapy. If you've noticed in the last couple of years, all these drugs are breakthrough therapies. And why they're breakthrough therapies is because they are being approved in really narrow patient populations. So cancer is becoming, in a personalized world, every cancer patient is really a rare disease, or every disease is now a rare disease. And so we need to do better in clinical trials. We need to learn, 97% of patients we're not learning anything on in a retrospective or prospective way because they're not in a clinical trial. Research from last year really shows that 87% of patients are either willing or somewhat willing to participate in a clinical trial, but yet there's significant hurdles to participation, 30% around geography, 10% around awareness, and 3 to 5% on trust. So as we think about technology, we can improve awareness. We can use a patient's personalized health information. They sign a HIPAA authorization, and we can use their PHI to actually start to deliver clinical trials that are really applicable to them in a very personalized way. And what also happens is technology can really shift the trials model. So today what happens is we have a really investigator-centric model. So an investigator signs up for a trial and then looks for patients that fit that criteria. Well, in a personalized world, that patient may or may not be in that academic institution. And so as we move forward, we can start to look at not only the academic institution, but communities, patient portals, patient communities, navigators, to really start to reach those patients in a personalized way. And I know we've talked about this, but with the advent of EMRs and patient portals and the Human Genome Project and the fact that we're doing genomics on patients, we're going to have this explosive growth in healthcare data. And with that data will become an opportunity for us to really learn and start to learn about each and every patient in a really personalized way, which will be incredibly important in this new era of personalized medicine. And you know, just finally and lastly, it's a pretty exciting time in cancer care. We're having this convergence of all of these new, we're finally, the digitization of healthcare, and we're finally getting to the place where we're actually moving technology forward into the 21st century. With the genomics of cancer, we're starting to understand in a very personalized way about every cancer patient's individual biology. It's creating huge amounts and vast amounts of data. And then, you know, there's also all of these initiatives about patient-centered care and patients actually participating in their healthcare, being a part of the healthcare process, making decisions, and the consumerism, and all those convergence of those details create a really exciting time to be in cancer care. Thank you.